Pregnancy is a time of immense change and anticipation as your body nurtures a growing life within. Understanding the basics of fetal positioning can help you feel more informed and empowered throughout your pregnancy journey. When we talk about fetal positioning, we use specific terms to describe how your baby is lying within your uterus. These terms include lie, presentation, position, and attitude. Lie refers to the relationship between the long axis of your baby's body and your own long axis. Presentation describes which part of your baby is closest to your cervix. The most common and desired presentation is cephalic, meaning your baby's head is pointing down. Position refers to the relationship between a specific point on your baby's presenting part and your pelvis. Finally, attitude describes the relationship of your baby's body parts to each other. Understanding these basic terms can help you better understand your healthcare provider's assessments of your baby's position as your due date approaches. While most babies settle into a head-down position as pregnancy progresses, sometimes they can adopt an abnormal lie. An abnormal lie occurs when the baby's long axis is not parallel to the mother's. Instead of being positioned head down or bottom down, the baby might lie horizontally across the uterus, known as a transverse lie. In some cases, the baby might lie diagonally, which is called an oblique lie. Several factors can contribute to an abnormal fetal lie, including the mother's uterine shape, the amount of amniotic fluid, and the presence of uterine fibroids or a placenta previa. Early detection allows healthcare providers to discuss management options with the expectant mother, ensuring a safer birth experience. While a head-down position is ideal for labor, some babies present differently. This is known as malpresentation, where a part other than the baby's head enters the birth canal first. Breech presentation is a common type of malpresentation where the baby's bottom or feet are positioned to be born first. Other malpresentations include face presentation, brow presentation, shoulder presentation, and compound presentation, where the baby's hand presents alongside the head. Malpresentations can arise from various factors, including a prematurely ruptured amniotic sac, a history of preterm labor, or a multiple pregnancy. Techniques like external cephalic version, where a healthcare provider attempts to manually turn the baby into a head-down position, might be employed. However, in some cases, a cesarean delivery might be recommended to ensure the baby's and mother's safety. Even when a baby is in a head-down position, slight variations in the head's position relative to the mother's pelvis can influence labor. These variations are known as malpositions. Malposition occurs when the baby's head is tilted or rotated in a way that makes labor less efficient. One example is occipito-posterior or OP position, where the back of the baby's head faces the mother's back. This position is often referred to as back labor and can cause prolonged labor and increased back pain for the mother. Another example is occipito-transverse position, where the back of the baby's head faces the mother's side. During labor, healthcare providers will monitor the baby's position and might suggest position changes or other techniques to encourage the baby to rotate into a more favorable position. As pregnancy progresses and labor nears, the baby's head, or presenting part, begins to descend into the mother's pelvis. This process, known as engagement, is a positive sign that the baby is preparing for birth. Engagement is typically assessed by feeling the baby's head during a pelvic examination. When the widest part of the baby's head has passed through the pelvic inlet, it is considered engaged. Engagement can occur weeks or even days before labor begins, particularly in first-time mothers. In subsequent pregnancies, engagement might not occur until labor is underway. Factors that can influence engagement include the baby's size and position, the shape of the mother's pelvis, and the amount of amniotic fluid. Understanding engagement and its significance can help expectant mothers prepare for labor and delivery. Breech presentation, where the baby's bottom or feet are positioned to be born first instead of the head, is a relatively common complication affecting about 3 to 4% of pregnancies. Several factors can increase the likelihood of a breech presentation, including a history of preterm labor, multiple pregnancies, uterine abnormalities, and fetal anomalies. Breech presentations can be classified into 3 main types: frank breech, where the baby's bottom is down with legs extended up towards the head. Complete breech, where the baby's bottom is down with legs folded. And footling breech, where one or both feet are presenting first. Managing breech presentations depends on various factors, including the type of breech, the gestational age, and the mother's preference. Options include external cephalic version, where a healthcare provider attempts to manually turn the baby into a head-down position and planned cesarean delivery. The decision to attempt a vaginal breech delivery versus a cesarean is complex and requires careful consideration of the risks and benefits for both mother and baby. If you found this information helpful, please like, share, and subscribe to our channel for more content on pregnancy and childbirth. Your support helps us create more valuable resources for expecting parents. When a baby is found to be in a breech position, healthcare providers might recommend various management techniques to encourage the baby to turn into a head-down position. One commonly employed technique is external cephalic version, or ECV, a procedure performed by a trained healthcare provider, typically after 36 weeks of pregnancy. During ECV, the provider gently applies pressure to the mother's abdomen, attempting to manually rotate the baby from a breech position to a head-down position. ECV is a non-invasive procedure, but it does carry some risks, including premature rupture of membranes, fetal distress, and the need for an emergency cesarean delivery. Another technique involves specific maternal positions and exercises that can encourage the baby to turn naturally. These include spending time on hands and knees, using a birthing ball, and swimming. While these methods have varying success rates, they are generally considered safe and can be incorporated into the expectant mother's daily routine. In some cases, a healthcare provider might recommend a technique called moxibustion, a traditional Chinese medicine practice. While breech presentation involves the baby's bottom or feet presenting first, transverse and oblique lies present unique challenges during labor. In these situations, the baby lies horizontally or diagonally across the uterus, making a vaginal delivery extremely difficult and potentially dangerous. Transverse lie occurs when the baby lies sideways in the uterus, with their shoulder typically presenting first. Oblique lie is a variation where the baby lies diagonally, neither completely transverse nor longitudinal. These lies are often associated with factors like a history of preterm labor, uterine abnormalities, and multiple pregnancies. Transverse and oblique lies almost always necessitate a cesarean delivery to ensure the safety of both mother and baby. Early detection of transverse and oblique lies is crucial, allowing for planned cesarean deliveries to minimize potential risks. Throughout pregnancy, healthcare providers closely monitor fetal lie and position through physical examinations and ultrasound scans. Throughout pregnancy, regular prenatal care plays a vital role in monitoring your baby's growth and position. Your healthcare provider will use various techniques, including physical examinations and ultrasound scans, to assess your baby's lie, presentation, position, and engagement. Early detection of any abnormal fetal positioning is crucial for timely intervention and management. If an abnormality is detected, your healthcare provider will discuss the potential causes, risks, and available management options with you. By working closely with your healthcare provider and actively participating in your prenatal care, you can increase the likelihood of a safe and healthy delivery for both you and your baby. Remember, knowledge is power, and understanding fetal positioning empowers you to make informed decisions throughout your pregnancy journey. While understanding abnormal fetal positioning and its potential complications is essential, it's equally important to approach childbirth with a sense of empowerment and positivity. Engage in open and honest conversations with your healthcare provider about your concerns, preferences, and any fears you might have regarding fetal positioning and delivery. Ask questions, seek clarification, and actively participate in decision-making processes. Seek support from your partner, family, friends, or a childbirth educator. Surround yourself with a network of individuals who can provide emotional support, encouragement, and practical assistance throughout your pregnancy and childbirth journey. Knowledge can empower you to approach childbirth with greater confidence and a sense of control. Section 11, Glossary of Terms. Amniotic sac, the fluid-filled sac that surrounds and protects the baby in the uterus. Breech presentation. When the baby's bottom or feet are positioned to be born first. Cephalic presentation. When the baby's head is positioned to be born first. Cervix, the lower, narrow part of the uterus that opens into the vagina. Caesarean delivery, a surgical procedure to deliver a baby through an incision in the abdomen and uterus. Compound presentation, when a hand or arm presents alongside the baby's head. If you found this video helpful, please like, share and subscribe to our channel for more informative content.